cellular therapy to treat a variety of injuries at the shoulder. Before we get into that, let's actually talk about the anatomy of the shoulder a little bit to better understand what can happen. So the shoulder is made up of the scapula and the humerus, and the humeral head joins with the scapula at the glenoid. So you have the shoulder joint, which is called the glenohumeral joint, but you also have these tendons that are from the muscles of the rotator cuff, and these rotator cuff muscles are essentially what gives you the various movements of this ball and socket joint at the shoulder. Very commonly, people can have injuries to these tendons, and this you will have heard as a rotator cuff tear. And this means simply that there is a tear or injury to one of these or more of these tendons at the shoulder joint. When there is an injury to the tendon, this causes inflammation, and people will often feel pain with movement, as well as loss of range of motion. They may not be able to move their arm up over their head or back behind their body without having pain and weakness. And so we can use cellular therapy to help not only decrease that inflammation and decrease the pain that you may experience with movement, but we can also use it to help allow those tendons to heal. Cellular therapy, whether it be platelet-rich plasma or your own bone marrow-derived stem cells, helps in this healing process by fighting the inflammation and signaling the body's own native stem cells to trigger the natural healing cascade.